So cardiac arrest is the complete cessation of cardiac activity. There would be an absent carotid pulse. Cardiac arrest was terminal before advent of CPR and external defibrillation in 1960s. Few cardiac arrest patients survive outside a hospital without a rapid sequence of these events, which are called chain of survival. Early recognition and activation of emergency medical service, immediate bystander CPR, early defibrillation, early advanced cardiac life support, integrated post-cardiac arrest care. Defibrillation, CPR prolongs period during which defibrillation can be effective. Defibrillation has resuscitated patients with cardiac arrest from ventricular fibrillation. So do not underestimate defibrillation. Non-traditional responders like laymen are being trained in automated external defibrillation use. Early defibrillation will impact survival definitely. So if the time is less than 4 minutes, survival is much better at 80 to 90%. As the time is prolonged above 8 to 12 minutes, the survival falls sharply below 20%. So why is CPR important? Studies have shown that the general population will start CPR only 1/3 of the time, and rest of the time they would be looking on. And only 15% of that total is done correctly. So there is a need for general population training in CPR. Chest compression can be started within 10 seconds of arrival at the patient, whereas airway first activities will delay the compressions by 1 to 2 minutes or more, and obviously will result in poor survival of the victim. Sequence is chest compression, chest compression, chest compression, and then airway and breathing. Until and unless there is a pulse, then obviously only breathing problems are addressed. Make sure the scene is safe. Don't be hero, don't be heroic, don't act over smart. Always make sure that the scene is safe. Take the victim to safety if needed. Check responsiveness and breathing. If you are alone, first call 1122 here in Pakistan, and you can get a manual or automated external defibrillator. Check for a pulse, and if no pulse is present, then you should begin chest compression, chest compressions, and chest compressions. Chest compressions and breaths are the same for adults, children, and infants. If you are alone, adult age is considered with those above 12 to 14 years of age. Child age is considered 1 year to the puberty. Infant is anyone under the age of 1 year. Compressions should be pushing hard and fast at 100 per minute with 30 compressions followed by 2 breaths, and make sure that the chest re-expands completely at the end of each chest compression. These characteristics of chest compressions are followed, and this ensures quality resuscitation and also affect survival. So should not be neglected and should not be missed. You should always be considerate to these adults. Open the airway with head tilt chin lift technique. As you can see the EC clamp technique in the figure, you will use this technique. Deliver each breath over 1 second to the patient. The automated external defibrillator should be applied ASAP to the patient's bare chest. You will make sure the pads adhere to the skin, and so you remove all clothing from the area where the pads need to be placed. Remove any medication patches from the area. Shave any chest hair. The pads need to be on as much bare skin as possible. If the patient has implanted pacemaker, place the pads at least inch away. These are different automated external defibrillators. The first step in all of them is to turn them on, and then they will produce a voice, they have voice prompts, and that would instruct you to do the things. When you use automated external defibrillator, assess compression effectiveness if CPR is in progress. If the patient is unresponsive and CPR has not been started, begin providing chest compression and rescue breaths at 30:2, continuing until the automated external defibrillator has arrived and is ready for use. Using an automated external defibrillator, turn them on, apply the pads to the chest and attach the pads to the AED. Stop the CPR temporarily and verbally and visually clear the patient. Push the analyze button if there is one. Wait for analysis of cardiac rhythm. If no shock is advised, perform 5 cycles, that is 2 minutes of CPR, and then reanalyze the cardiac rhythm. If a shock is advised, recheck that all are clear and push the shock button. After shock is delivered, immediately resume CPR, beginning with chest compressions. After AED shocks, if a patient is breathing independently, administer oxygen, check pulse. If patient has pulse but breathing is inadequate, assist ventilations are required. That is it for today. Thank you very much.